I'm so glad you found the Blaine County virtual data walks in case you missed our community data walks. Today, we'll briefly talk to you about the Blaine County Communities for Youth initiative and what we've learned in the data in our second year of data collection. The idea behind Communities for Youth is to help communities move towards upstream prevention. So often what we do is we wait for something horrible to happen and try to respond afterwards. We're doing a lot of crisis response right now. We're responding to drugs, mental health, you name it, we're running after every problem. Upstream prevention asks us to actually look upstream and think about what are the root causes of some of these things. In fact, in this picture, what you'll see is there are what we call risk and protective factors at not only the individual level, which is often who we're thinking about when we consider a kid who might be struggling with depression or substance use, but actually there are things in the peer environment that impact that person's challenges. There are things in the family environment, such as experiencing family violence or great relationships with parents. There are things in the school environment, like feeling challenged, feeling like the school is linking to your future purpose, and feeling like you have good relationships with people at the school. And then finally, there are things in our greater community that impact both our mental health and our substance use. These are things like having access to green spaces, having a close-knit community, feeling like there are lots of things to engage with, and feeling like you fit in your community. So what we're trying to do with the Communities for Youth Blaine County Initiative is to think across the risk and protective factors at each one of these domains, and then think about how we collectively, as a community, make this the best possible place for our kids. Our process is a 4-step process, and we repeat these steps each year. So the first step is building a community coalition. And thanks to the Mental Wellbeing Initiative in your community, there are lots of folks building coalitions. And to be a part of the coalition, all you have to do is answer the question, do you want to be part of building the best possible community for kids? If your answer is yes, we want to hear from you and connect you to the existing coalitions in your community. The second step is centering the youth experience. So often adults think that we know all the things that young people are experiencing. And it's really important to combine what adults know with what the actual youth experience is. And that is why the survey is integral to this process each year. Essentially, what we do is ask young people to respond to multiple risk and protective factors, as well as the outcomes we care about. And Blaine, we're looking at things like mental health outcomes, substance use, and other well-being things like chronic absenteeism. The third step is really about once we get that data back, sharing it out, having conversations together in the community, and thinking about what goals we want to set and what actions we want to take to reach those goals. Last year in Blaine, we really wanted to focus on increasing social connection for youth and also increasing sleep hours, because those were two of the main risk and protective factors that were prevalent in Blaine County students. The last step, keep the conversation going. We're so excited you're here today because this is part of step 4. Really, we'd love everyone in your community to understand what the data is saying about young people and what our community together has decided to work on. The good news is that in Blaine County, we're actually seeing small declines over the years. So we have seen depression decline, that's the orange bar there, from 27% to 25%. We've seen declines in sleeping less than 8 hours per night, which is what we're hoping for. Last year, we focused on sleep and social connection, and you can see that both of those have improved from last year to this year. We're hoping to see even greater improvement as we better organize with the community and think through our action plans. This year in Blaine County, we have some key risk and protective factors. These include feeling high levels of stress, feeling low levels of social connection, not getting enough sleep, which the recommended hours are 8 hours or more for high school students and 9 hours or more for middle school students. And the last variable that came up is an idea of contagion. So this is the notion that our young people think that many people in their community are experiencing depression, and this can actually lead to higher rates of depression in themselves. So after you watch the videos, you're going to go ahead and on the website, there's a fill out the vote, and you're going to let us know what you'd like us to help your community focus on this year to make this the best possible community for you.
This graph is showing the relationship between stress and self-awareness. In this first bar here, these are the students who reported feeling low self-awareness. Among students with low self-awareness, 56%, or over half of those students, also reported feeling highly stressed. Compare that to the group of students who reported feeling high self-awareness, which is this third bar here. Among students with high self-awareness, only 11% reported feeling highly stressed. So what you can see is that as self-awareness goes up and goes from low to medium to high, those feelings of high stress decrease. And this means that self-awareness is really acting as a protective factor against stress in our youth.
This graph is looking at the relationship between depression and social isolation. So let's look at this bar here on the left. These are the students who reported low social isolation. And among those who reported low social isolation, 6% of them also reported moderate to severe depressive symptoms. Let's go to this bar here on the far right. These are students who reported high social isolation. And of those who reported high social isolation, 83% of them also reported moderate to severe depressive symptoms. So why this is important for us is it helps us see that teens who report lower levels of social isolation also report lower levels of depressive symptoms. And so the opposite of isolation is connection. So when we can give students opportunities for connection, and when we help foster connection, that can be protective against depressive symptoms.
This graph is showing the relationship between depression and sleep. In this first bar here, these are the students who reported sleeping less than 8 hours per night on an average night. 8 hours per night is the minimum required sleep for youth. Among those students who reported sleeping less than 8 hours per night, 35%, or about 1 in 3 of those students, reported also feeling moderate to severe depressive symptoms. Compare that to this bar here, which represents the students who are sleeping 8 or more hours per night. Among these students, only 15%, or about 1 in 6, reported feeling moderate to severe depressive symptoms. This means that teens who sleep 8 hours or more per night are reporting less rates of depressive symptoms, and sleep is acting as a protective factor against depression.
We have two groups here. We have a group of students indicating that they feel low family support, so not feeling super connected with their family. And then we also have another group that's indicating that they feel high levels of family support. So they're feeling connected to their family, emotionally supported by their family, things of that nature. So these graphs aren't necessarily saying that 48% of students are feeling low levels of family support. What this is saying is that of the group of students that indicate that they feel low levels of family support, 48% of those students are also reporting high levels of stress, so about half. And then in the group that's indicating that they feel high levels of family support, we're seeing that about a quarter of students are indicating high levels of stress. So, all in all, teens who have high family support report less stress.
So this graph shows social isolation in trusted adults in Blaine County teens. So there's two groups, those who reported that they have a trusted adult and those who reported that they do not have a trusted adult. And among those, they also reported having high social isolation. So the main takeaway from this is that teens who have a trusted adult report less social isolation, and that having a trusted adult is a protective factor for social isolation.
This graph shows the percentage of students who reported feeling moderate to severe depression symptoms broken down by grade and by gender. Boys are represented by the teal bars, and girls are represented by the orange bars. Depression in the survey was measured using the PHQ-9. The PHQ-9 is a scale used by doctors and clinicians to measure the degree of depression symptom severity. Across all grades, girls reported feeling more moderate to severe depression symptoms than boys. In terms of grades, students in the 8th grade, for both boys and girls, reported feeling more moderate to severe depressive symptoms than in any other grade.
Thanks for being here today, and we really look forward to continuing to work with you.